Today I'm going to do something quite different. Some of it's going to be similar, because I want to give some just general definitions of inflammation, but I want to talk about stacking. Most of these things are covered in my book in further detail, but every time I'm doing a lecture now, I'm kind of taking a little aspect and going a little bit deeper so that we can have more and more information. I will recommend all of you to go back to the last 2 years of my lectures on this platform, The Real Truth About Health, and also go to my website. There's a media section on sengevity.net, and you can look at all the other videos and interviews and lectures that I've given at other conferences as well. The more information that you get, we're evidence-based. So what that means that we're using anything that's scientifically proven or shown in the clinical literature worldwide. And that's what we want to improve every day is your outcome. Rather than saying it's conventional or alternative, being integrative, we're looking at the patient's improved outcome by any means necessary, looking at potency, purity, safety, and efficacy of what we do. Today, I'm going to talk about the stacking effects of inflammation and basically how to avoid it and reduce it naturally. So first, I want to talk about just, again, giving you a general idea and definition of what inflammation is. Inflammation is now what we consider, and this is something that I've been working on for the last 20 years, and particularly when I wrote my book after many years of practice, 22 years of seeing thousands of patients with these chronic inflammatory diseases, is looking at what is that underlying triggering mechanism, and can we get it at the root cause? Can we stop the progression of disease? And now we look at we can. And in my book, I have 10 steps, and it's about epigenetics, your diet, your lifestyle, the change in the environment, and also the improvement of your belief system. Your body has an innate ability to heal. We just have to give it all the tools that it needs to do so. So inflammation is the triggering mechanism here of all diseases. And in fact, more recently in the last 2 years, and last year I gave a specific lecture just on COVID and the comorbidities of why we get actually more problems here in the United States, having more comorbid health conditions like heart disease, diabetes, obesity, and autoimmune conditions, where when the virus came, which is a pro-inflammatory triggering mechanism that hits our body, it made us in the United States have more fatalities, unfortunately. So right now you can see almost every single disease now has an inflammatory component. And, I always describe it as the fire within the body. And the suffix itis, I-T-I-S, okay, that means inflammation. And inflammation is derived from the word fire or flame. So when you see here on the upper left, you see this kitchen, you see this living room, and you see this bedroom. We need a certain amount of inflammation. Inflammation is not always bad. Inflammation actually triggers and controls hundreds and hundreds of biological mechanisms of keeping your body in balance, right? So you need to cook your food in your kitchen, you need to keep your house warm during the winter, and you need to stay cozy in bed at nighttime. However, when it's uncontrolled here at the bottom, and you see this aspect of the kitchen fire or the bedroom fire or the living room fire, that's too much, and that is what the itis. Itis just means inflammation of whatever the word we put in front of it. It's inflammation of that area. So too much inflammation becomes a problem. Now we see that, hold on, I'm just going to move this here. We see that there's something called an acute versus chronic inflammation. So most of us are familiar with both. We can have an allergic reaction, we can have an infection, we can actually get, like most of us will have some kind of injury. Maybe we sprained an ankle, or we injured ourselves, or maybe even cut ourselves, for example. That's an acute inflammatory response. Even fever is an acute inflammatory response, which in those cases are indicated. We want to have a fever because that's eliciting your immune system to upregulate and help fight and fix and repair whatever the problem is. The problem is when that fever becomes chronic, or, for example, in the beginning, when we have a wound, for example, you sprain your ankle, that ankle will swell. That swelling is an inflammatory response, not only due to the trauma itself, but it's also the healing aspect. The body's saying, don't move your ankle now. Like, it's going to make like a cast. It's going to be frozen almost. It's going to be stiff. It's going to be swollen because the body now needs to heal from the damage. So acute inflammation in general usually has an important role of telling us, hey, something is on. We need to pay attention. The problem is, for most of us in the United States and around the world, we are moving into this chronic inflammatory state where we see chronic diseases, from heart disease and neurological diseases, autoimmune cancers, and you name it. This is chronic inflammation, and we want to learn how to reduce that successfully. Now, chronic inflammation also leads to chronic diseases, as I just mentioned. So here's a picture of the knee. on the upper left. I don't know if you can see my cursor or not, so let me know, Ben, if they can see my cursor, Nancy. But you have your healthy knee here, and then we have arthritis of the knee, right? So this inflammation of the joint causes this degeneration. If you look at the bottom left here, we have a healthy colon. And just the other day, I gave a lecture on the microbiome, and we'll talk about that, where now we get inflammation, then you can get ulcerative colitis, right, of the colon, inflammation of the colon, Crohn's disease, and different IBS type of symptoms. And then on the upper right here, you can see is the cardiovascular system. These are arteries of the heart. And you can see it's kind of clear right now, a normal cross section. And as someone eats more pro-inflammatory foods, more animal protein and saturated fats, which contain cholesterol and are pro-inflammatory, that leads to us having this heart disease problem where every minute, 3 people in the United States are having a heart attack. And it's still the number 1 cause of disease in the United States and worldwide is still heart disease. And when we look at neurodegenerative diseases like Alzheimer's now and Parkinson's disease, dementias, now we're looking at the brain being inflamed over decades due to a variety of things that I will speak in my book and I've spoken in my lectures and I'll also talk about today. So when the body gets hit, whether it's the GI tract, whether it's your arteries, whether it's your brain, whether it's your joints, the chronic diseases make that part of the body more degenerative and worse. Furthermore, the chronic inflammation also makes us age. So we have these little telomeres. These are our end caps of our little, our chromosomes. And with inflammation, it actually helps shorten them. And we're trying to extend these little telomeres. And so the more inflammation that we have, the more oxidative stress that we get, and actually the shorter the lifespan. So changing the diet and the lifestyle, the environment and belief system is important because we're trying to decrease the amount of inflammation in our body. Now, we have over 200 different itis conditions. This is just a few, but remember anything with the itis afterwards. So if I can start from the top of my head, we can have like dermatitis, you can have conjunctivitis, red eyes, you can have runny nose, rhinitis, you can have sinusitis, you can have, we had a wonderful doctor yesterday, dentist, talking about gingival disease, or periodontitis, right? You can get laryngitis, which I kind of have right now, a little bit of a raspy throat. People can get a pharyngitis, we can also get a thyroiditis, we can get esophagitis, heartburn and reflux, we can get gastritis and colitis and vaginitis and prostatitis and arthritis. So as you know, almost all of us will have experienced some kind of inflammation, whether it's mild or moderate or severe in our lifetime. And the goal is to look at not just treat the skin with a topical ointment or the eye drops or the nasal sprays or the oral care or the inhaler for the bronchitis or the upper pill or the lower pill for the GI tract or the joint pill. What we're looking at is what are the underlying triggering mechanisms that make all of this itis and all this inflammation more abundant and damaging.